Hi, my name is Christian Hunter, and my group decided to do our social policy group paper on Medicare. Medicare is a health insurance that's provided by the government for elderly people of age of 65 and older. Also, it is for people who are under the age of 65, but they have to have a certified disability. Medicare was introduced back in 1965 from our president Lyndon B. Johnson. The bill was also signed by our president Lyndon B. Johnson in 1965, and it was an important part of the Social Security Act of 1965. Medicare and Medicaid was introduced because of hospital bills, medical bills, and things like that um, they felt that elderly people needed to be taken care of after retirement. There were many debates in Congress about it because it is an expensive government issue that the government felt like they didn't need to be in charge of. Also, because of this, and they didn't want to sign the bill. Medicare was supported by many hospitals, many medical insurance groups, and um, testimonies by elderly people who wanted this bill to be signed, and because of that, the bill was signed. During this interviewing process, I decided to interview my grandmother, who her name is Mary Elizabeth Hunter. She was born on October 31st, 1936. Today, she stands to be a 75-year-old African American woman. She's middle class. She's been married for over 50 years with three adult children. She has an ethnic background of African and Indian descent. She also took her life to Christ at a young age and became a Baptist. Her habits include baking, cooking, going to the casino, and doing crossword puzzles. Her education level um, is up to high school. She graduated from Raglan High School. Um, Her physical conditions, as through old age and getting older, she started to have type 2 diabetes, a heart condition, and blood pressure. Also, throughout her life, she was a housekeeper for more than 30 years. I decided to do my interview on her because I know for a fact that she is receiving Medicare. And the type of things that I decided to ask her was, you know, what age was she when she started receiving Medicare? And it was for a fact she started to receive Medicare at the age of 65. Um, and I know for a fact that I talked to her about her back in 2004. She had to go to the hospital because she was having plenty chest pains, and through observation and different testing, the doctors found out that she had clogged arteries, and that she needed to have a triple bypass surgery as soon as possible in order to live. Um, this the thank the Lord that the surgery was successful, and she received the triple bypass surgery. She was in the hospital for about 4 weeks. Through all the issues with her heart condition and pain, she did not have to go through the problem of having medical bills because of the fact of her having Medicare, and she also has a supplemental insurance through United American Insurance. Um, I asked her about what different parts of did she have the original Medicare plan, which includes in Part A and B, or if she had the Medicare Advantage plan, um, which includes the prescription coverage and things like that. She said she just had the original Medicare plan. she has a supplement her supplemental insurance. She has a separate coverage for her she has separate coverage for her prescriptions. She receives insulin, heart medicine, and blood pressure medicine that Medicare does not cover. She talked about her supplemental insurance, United American, that she likes it because it was something that she had. It was her medical insurance that she had that was provided by her husband's job. Before she started receiving Medicare, she did say for a fact that the premiums are expensive, but without, the supplemental insurance, that she would have extra medical bills. She also stated that Medicare pays 80%, and the lasting 20% is paid by her supplemental insurance. I asked her many questions about um, having pros and cons about Medicare, and actually she didn't have any issues with Medicare like many other elderly people may have, because they may not be able to afford supplemental insurance. Only thing she said is if it was some way that she didn't need to pay for supplemental insurance, she would love that for Medicare to be 100%. But that is the only issue that she has with Medicare. Um, Also, I would like to tell you about the program that Medicare has. They have the PACE program, which means program for all inclusive care for the elderly, and basically it is for the elderly. It's offered in 75 programs. It's offered in 29 states. It's basically having like it's basically for elderly people who will receive bills, hospital bills, and medical bills, and if they're living in nursing home and different things like that. If they're within the PACE program, all those premium, the monthly premium will be covered through PACE, and they will not have any medical bills at all through living through a long term care program. Lastly, I wanted to talk about Medicare being separated in different parts. There's Part A, Part B, Part C, and Part D. Part A basically covers hospital insurance, emergency room, different things like that. Part B is basically the total, medical insurance, doctor's appointments, different testing and things like that. And lastly, Part C is the Medical Advantage Program, which includes Part D in the Prescription Coverage Program. Throughout this experience, I've learned many things about Medicare, and I know to this day there are still many debates about Medicare, and hopefully, and because of our debt situation with our government, I would love, to be able to have this advantage as my grandmother has, and be able to be just as just as good with Medicare as she is, and how she doesn't have many complaints about it, and I hope I get to share that same experience. um, Also, I just love the fact that this bill did get to pass, and we get to take care of our elderly people, after retirement, and I just hope I receive the same experience. And thank you for your time.